Washing my hands. Hi, how are you?
Fine, how are you today?
Is it okay if I call you Miss Williams?
Yes.
Hi, Miss Williams. I'm Raychell. I'm going to be your student nurse midwife for today.
Okay.
I'm going to be doing a head, ears, nose, and throat exam on you. So first I will inspect your head, which is basically I'll be looking at your head and feeling your head, making sure you don't have any lumps, bumps, bruises, any protrusions, or anything. Make sure your skull is symmetric as well. Is it okay if I touch you?
Yes.
Okay. Just palpating the front and the back, your occiput, and everything feels good. Just looking at your face, looking at your eyes, making sure they're symmetric. Your eyebrows, which look also pretty symmetric. Your face is nice and even, no edema. Next, I'm going to be looking at your throat. So your throat looks pretty symmetric, no discolorations. I'm going to touch and palpate your trachea. Can you swallow for me? Awesome. I'm going to touch your temporal arteries and feel for them. Good. I'm going to touch your TMJ, which is transmandibular joint. Can you open and close your mouth for me? Good. Just trying to make sure you don't have any clicks or anything, and everything is fine. Next, I'll come behind you and check your thyroid. So I'll be moving your trachea to the side, and I'll be palpating for no edema, no swelling. To the other side. Feels good. I'm gonna palpate your lymph nodes, make sure there's no swelling or anything. So first I'll start at your pre-auricular lymph node and go behind your ear to your post-auricular lymph nodes. Go to your occiput. Then I'll go to your anterior cervical, and then your posterior cervical lymph nodes, up into your submandibular, your submental, and then back down to your subclavicular, and underneath your clavicle. And it feels good. So what I was checking for is basically a pea-like structure. It's pea-like in shape and size. So if I were to feel anything, and if it was movable and non-tender, that would be fine. But if it was fixed and pretty tender, then that will cause us some concern, and we'll get other diagnostic tests ran. And also, when I checked your trachea, if there are any edema or anything within your trachea, I would have listened with my stethoscope, just to see if you had, or any bruise, which is swishing within the stethoscope, and that would cause concern for some thyroid issues. So now I'll take a look at your eyes. So your eyes look very symmetrical. I'm looking at your sclera. I'm looking at your pupils. They look good. Your sclera is nice and white. If I were to see like yellow sclera, I'll be concerned for increased bilirubin, which sometimes can be caused from liver problems or something wrong with your gallbladder. But it looks nice and white. I'm gonna take my light source, and I'm gonna look at your cornea reflex. So I'm gonna shine this light straight towards your eye. I just need you to look straight forward towards me. Great. I'm gonna do your right eye. Awesome. What I'm looking for there, if I were to see the light source not symmetric in both eyes, that would be a cause from like some weakness in the nerves in your eye, or some kind of paralysis. But it looks fine. Next, I'm gonna do a pupillary light reflex, which I will be looking at your pupils and how they constrict. So I'll be going from side to side, looking within your pupils. Great. Awesome. I'm gonna look one more time. So the reason why I did that twice was the first time I looked for direct reflex, which is me going directly to the eye and seeing constriction. The second time I was looking for consensual reflex.
Mhm.
So when I shine my light into your right eye, I would like to fade your left eye constrict and vice versa, which it did. Next I'll be looking at your sclera and your conjunctiva. So I'll kind of bring your eyes down, your eyelids down. You know, check in, make sure they're nice and pink. Now look at your eyelids and your eyelashes, which they look pretty good. I'm gonna take this otoscope here and look at your fundal, your ocular fundus, which is the retina behind your eye. So I'll be kind of close to you, face to face with you. Just letting you know in advance. So I'm gonna take this otoscope and you can see your right eye. And goes up opposite side. Which I am looking literally to behind your retina. So what I see is like a red light, and then behind that, what I see is blood vessels. Checking to make sure they're not enlarged or anything like that, which they look fine. I see your optic disc, I see your macula, your fovea, and all of that looks great. Next, I'm going to check your ears. So for your ears, I'm just gonna look at them, see if they're symmetric, which they are. Have you had any pain within your ears or anything like that?
No.
Good. I'm gonna palpate. I'm gonna kind of pull them a little bit. Any pain?
No.
Awesome. I'm gonna look inside your ears. So what I will do is pull them back a little bit to kind of open them up, and then I'll look inside, looking at your tympanic membrane, which looks fine, and everything looks good. No edema, no redness, and they're nice and clean. Okay. So what I look for within your ears, no redness, no swelling. I looked at your tympanic membrane and it looks fine. And I'm gonna do a whisper test.
Okay.
So what I will do is put my hand over your ear and I'm gonna whisper something, and I want you to repeat what you hear.
Apple. Baseball.
Great. So next I will be assessing your nose. So I'll get you to raise your head back, and I'll be looking inside your nose with this otoscope. So I'll take this otoscope and look inside your nose, looking at your mucous membranes. I won't go in too deep because your nose is very vascular, and if I puncture anything, it may bleed. It looks good. Your turbinate looks awesome, and your septum isn't deviated, and it's very midline. So next I'll be checking your sinuses. Do you have any sinus issues?
No.
Okay. I'm going to take my fingers and kind of tap, 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 tap. Any pain?
No.
Tap, 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 tap. Any pain? Great. So next I'll look inside your mouth. So first I'm looking at your lips, making sure they're nice, pink and moist, no cracks, no breaks. And I'm gonna take a look at your teeth. Can you smile for me? Beautiful, nice and white. I'm gonna look at your gums. Can you lift up your lips for me? Great. Can you do the bottom row for me? Awesome. Can you open up and let me look at your tongue? Nice and moist. Can you go from side to side for me? Good. Can you open up wide and I'm gonna look at the top of your mouth? Nice and white and pink. Okay, can you say ah for me? Uvula looks good. Tonsils look awesome. Good. So now I'm gonna take a glove and check the inside of your mouth. Make sure you don't have any masses. Looks good. All right, Miss Williams, thank you for this well-woman exam. Everything went fine. Everything was good. Everything was normal. No abnormalities, and you're physically, from my perspective, you're very well fit.
Thank you.
You're welcome.
Thank you for your time and your patience.
Have a good day.
You too.